checked my chart for allergies to latex or iodine, and I have gathered my equipment. I have checked the packages both for expiration date, for integrity, to make sure there's no tears or cuts and openings in it, and to make sure that they are both the proper size. Right? I am going to knock knock, come in. I'm going to check my patient. Good morning, can you tell me your name and date of birth? And are you allergic to anything? Okay, thank you. I'm going to lock my bed. Okay, I would physically go around and lock the bed. My side rails are up, and I would raise my bed to a proper working height. And I'm going to provide privacy. I'm going to close the curtain, and I'm also going to shut the blinds in the room. Okay, now I would put on my goggles and my work gloves, and I'm going to position my patient. As a female, I'm going to position her in the dorsal recumbent position, or I will position her on her sideline. Let's get her in a good position. All right. I would provide peri-care if necessary. Then I would remove my gloves, wash my hands, and I would be ready to begin. So I have all of my equipment established. I'm going to open my package on the serrated edge at the bottom of the package. Set this, and I'm going to fold my bag so it will be my trash can at the foot of the bed. And I'm going to put it to make sure it's not going to fall into my sterile field. Okay? Now, I'm going to turn my package with the top flap away from me. Okay? I am going to carefully open my package without touching any of the sides, inner aspect. I'm going to catch the two sides. I'm going to pull them and stretch, and it does flop up. Sometimes you just have to kind of crunch it if it won't work with me. I'm just going to let it be. Okay? They're not always very cooperative. I'm going to catch my last one, and then you actually can just kind of crunch the paper gently. I'm staying on the outside on the bottom at all times. But, oh, come on back. All right, now. Okay. I'm just going to let him be. All right. I'm going to move my trash out of the way. I'm not going to turn my back on my sterile field. So I have my table sitting beside me. I'm going to open my sterile gloves. And as you remember, we're going to open the top flap. We're going to open the bottom flap. We're going to catch the sides, and I'm going to just make sure they're not stuck before I start. I'm going to open my sides, making sure that I'm only touching the 1-inch outer border of the sides. Okay? I'm going to put my dominant hand glove on very carefully. Okay? I'm going to stabilize the paper and very carefully pick this up, and then I'm going to make sure that my thumb of my gloved hand stays out of my way. Okay? Now, I am sterile, so I can touch all inside here. And I'm going to carefully turn my package to where I think I'm going to be able to work without contaminating anything. So that's pretty good. Now, I'm going to get rid of these. Okay. Oop, oop, oop. I forgot to put my goggles on. Sorry, y'all. My goggles are on. I can't see. And I'm going to pick up my drape, remembering, and when I pick it up, if y'all see how it's folded, I pick it up with the thumb. And as I'm holding it, noticing that my back is up, I'm going to make sure that I have my thumb, but my fingers are on the inside. The shiny side is away from me. So if you can pick it up with all your fingers inside and your thumbs just sitting on the top, I am able to very carefully drop right here. okay? My field is overlapping. I'm good to go. I'm going to get rid of this, okay? I'm going to take these out and just get rid of them, okay? Now, I'm going to take my top section and I'm going to set it on the blue field. While I'm here, I'm going to go ahead and make sure my port is closed, because this is all sterile, so I'm fine. My port is closed, okay? I have all of this ready, and I haven't contaminated my hands, so I'm not worried about getting betadine anywhere. Now, I am going to carefully stand the betadine up. I'm going to pinch all the straws to one side so that when I tear this, I can very carefully peel it open, and then all I have to do is pick up my 3, and I'm going to lay them in this compartment. I'm going to change hands so that I don't cross over, and I'm going to drop it in my tray. All right, remember I'm still sterile everywhere, so now I'm going to attempt to open this lubricant, and it is terrible to open, so I tear it from the top because it works a whole lot better. And I'm going to squirt the lubricant into a blob. I'm going to bring it back to me, and I'm going to drop it. Noticing I'm never lowering my hands below my waist. Okay, now I'm going to take my cap off of my syringe, and I'm just going to throw it in there, and I'm going to connect the syringe to the port, and I like to make sure that the port is sitting right over here in this upper left corner where the syringe is pointing at the patient. It just makes everything flow better. Okay, now I'm going to gently take the shield off without letting the catheter flop. Okay, bringing it to me and getting rid of that. Now I am going to lubricate my catheter, and that should sit right here. I'm lubricating 1 to 2 inches, and now I have all of my supplies ready, and I am ready to clean my patient. So I'm going to say, I'm going to touch you now, and I am now contaminating this hand, but I am going to hold the urinary, the vaginal area open so that I can actually see the urinary meatus. And I am going to say, this is going to be cold and wet, and I'm going to clean the inner aspect of the outer labia, bring it to me, and drop. Okay, I'm going to get my second swab, the whole time trying to maintain this area open, which is very uncomfortable. I'm going to clean the inside from top down on the inner aspect, bringing it to me and dropping. Okay, and then the last one, we're going to go straight down the center, applying a little pressure to the urinary meatus. Oops, missed the trash. And I am ready. And I'm going to use my finger, and I'm going to actually bring this up with me. Don't drag it, you need to lift it. And I'm going to say, can you please take a deep breath? And I'm going to insert 2 to 3 inches, or until I see urine. And I'm going to say, there's urine. And I'm going to go another 1 to 2 inches. And then I'm going to hold my catheter with my other finger. I'm going to inflate the balloon slowly, making sure it's not blowing up at the top of the Y port. Keep my thumb tight on the plunger of the syringe. You can't let go. Give a gentle tug, and I am seated. I'm going to take my syringe off because I'm going to need it. Using my dominant hand to take this out, set this up, and I'm going to clean all this up. Got all that clean. I'm going to remove these gloves. Okay, I'm going to put on work gloves. I'm all done. I'm going to put on my work gloves. Okay, I'm going to stabilize my catheter. The whole time I'm making sure it's not tugging on the patient. And when I do it, I hold it in my hand with the green part at the bottom of my left hand, and all I have to do is just tuck it right under the patient's leg. Okay, I make sure my Velcro is loose. I'm going to take my Y port, okay, and I hold my Y port in the center of the two green areas, put the small piece through the hole, and then I lay the large piece supporting the actual catheter itself. I'm going to bring this over, and I'm going to come around and I'm going to hang it on the hook that's provided on this bed. Put my patient down, okay? All right. Now, I would do my general post procedures, have all of that done. You don't need to repeat all of that. And I would provide peri-care if necessary to clean all that excess betadine off. And I would document the date, the time, the procedure, the size of the catheter, the color, amount, and clarity of the urine, and how my patient tolerated it. And now, 3 days later, I'm coming back in, and I would do my general procedures, and I am going to empty my catheter. I'll move this out, Joe. All right. Now, I'm going to set the paper towel on the floor, open my urinal. Okay. I'm going to take my spout. I'm going to hold it over the urinal. I'm going to open the spout, drain it into the urinal. I'm going to reinsert it. Okay, I'm going to leave it there. I'm going to pick this up. I'm going to go into the bathroom. I'm going to measure and record this, discard it into the toilet. While I'm in here, I'm going to put the specipan in the toilet, or if it's a male, I'm going to bring the urinal back out with me to the bedside for the patient. I'm going to remove these gloves. I'm going to wash my hands and put on a new pair of work gloves, and I'm coming back out to my patient. And now I am going to remove the leg strap, and as I remove this leg strap, once I get this off, I'm going to support the catheter because I don't want to let it go loose and tug on my patient. Okay, so I have that out of the way. Okay, now I've got my tubing. I'm going to hold my catheter. Okay, I hold it back here, and I'm going to support the port so that I'm able to withdraw my water. While I'm still holding it in place, I would put my paper towel there first. Sorry, paper towel. Okay, I'm going to draw this out. I'm actually going to squirt it into my container, and then I'm going to do it one more time and show you the collapse of the port. So when I see the collapse of the port, there's no more water in here, I know I'm good. Okay, so you can take it off. And then I'm going to take my paper towel, and I'm going to say, all right, take a deep breath. I'm going to gently pull it out, and I'm going to say, the tip is intact. I'm going to fold it up in the paper towel. I'm going to disconnect, and I'm going to drop all of this into the trash can. Okay? I would clean my patient. Okay? I would remove my gloves, remove my goggles, and I would cover my patient up, and I'm going to lower the bed. I'm going to give her her call bell, make sure her side rails are secure, her bed is in the lowest locked position, give her her personal possessions, and I would wash my hands, and I'm going to teach her that you may have a little bit of discomfort when you void the first time. You need to make sure you call me when you need to void because I need to measure and record it. And if you have any prolonged discomfort or you are not able to void within 6 to 8 hours, you need to let me know. And finally, there's a nice jug of water over here. I need you to push fluids to push the bacteria out of your bladder and to make sure we encourage you to void. All right? Thank you. And then I would document the date, the time, the procedure, the color, amount, and clarity of the urine. I educated my patient, and she verbalized understanding and how she tolerated the procedure. And if this were a male patient, I would have put him in a supine position with his legs slightly extended, okay? And I could have left the bed up for you. And I would clean from the urinary meatus to the corona ridge in a downward circular motion. Bring it over and drop. I would clean from the corona ridge in a circular motion down the penile shaft, okay? The last one, I'm going to wipe right across the urinary meatus with a little gentle pressure, okay? I'm going to lube my catheter 5 to 7 inches. I'm going to insert it all the way to the Y port. If I met resistance, I would pull back and up and push a little bit of pressure downward on the patient in order to get past the prostate. And if he were uncircumcised, I would have retracted the foreskin during the cleaning. And after the catheter was in, I would replace the foreskin. And finally, I would secure it either with a leg strap or tape it to the lower abdomen. The end.